trained in CPR and first aid. I'm also trained to certify students to become trained in CPR and first aid. This video is to demonstrate how to effectively perform CPR on an infant using an infant mannequin. When you come across an unconscious victim, there are two scenarios that would potentially occur. Number one, an unconscious victim who is sleeping. If you were to try to check for responsiveness on an unconscious infant who is sleeping, you would flick the bottom of their feet and there would be a reflex response, so you would understand that they are responsive. When you come across an infant who is unconscious and non-responsive, you would flick their feet and there would be no reflex and no response to indicate that there was not a problem. If there's no response, you would then check for breathing. The way you would check for breathing is you would scan the stomach, you would scan the chest to see for any movement or rise of either body part. You can also listen for breathing by putting your ear next to their mouth. You could feel the warmth of their breath and or hear them breathing. That will also indicate whether they're breathing or not. If you have an unresponsive infant and an infant who is not breathing, you would then begin CPR. CPR is different than on an adult. CPR, you use 2 fingers in the middle of the nipples, on the sternum, and you would begin to elbow over the wrist in line with the fingers, and you would immediately begin compressions. You would do 30 compressions, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 16 and 17 and 18 and 19 and 20 and 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then you would perform 2 breaths. Now the breaths are different as well compared to the adult mannequin or the adult patient who's suffering. You would place, again, there is a face shield that I'll show you. It has a prong, and on the other side it does not have a prong. The prong will fit inside the mouth of the infant. So you place that prong inside the mouth. The face shield is there to protect you from the individual victim that you're treating, and you would place your mouth directly over the mouth and over the infant's nose. You would also do a head tilt chin lift. So the head tilt, hand over the forehead, 2 index and thumb on the chin. You would tilt the head, make sure your hand's not on the chest because that will impede the breath from going in, and you will breathe out so that your air goes into the infant's lungs. Then at that point you would begin 30 more compressions. The breaths are a quick breath. It's a kind of like a poof poof, not a deep breath, but just a poof poof will assist you in administering rescue breaths into the infant, and with that case into the infant mannequin that you're working on. So again, the breaths again, I'll show you the breaths one more time. Hand over the forehead, 2 fingers on the chin. You're gonna tilt the head, lift the chin, mouth over the nose and over the mouth. So it will look something like this. Real quick breaths, then you resume compressions of the chest. 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20, 22, 23, 24, 25, 26, 27, 28, 29, and 30. Head tilt, chin lift. You should see the breaths rise with the rescue breaths. You would complete 1 cycle of compressions and breaths, 30 compressions, 2 breaths, multiplied by 4. So 1 cycle is 120 compressions, which means 8 breaths. You would do a whole cycle of compressions and breaths, and then you would call 911. That completes my demonstration of how to perform infant CPR on an infant mannequin.